section, I'm going to give an overview of therapies available to those with schizophrenia. Antipsychotic medications can help reduce symptoms and are recommended as the first type of treatment that should be used. And I'm going to talk about medication in depth in part 7 of this series. In addition to medication, people can learn to manage their symptoms and improve their functioning with psychosocial treatment and rehabilitation. The treatments I'll cover are considered to be evidence-based practices. That means research has shown that these treatments are effective for people with schizophrenia. The first one we're going to talk about is social skills training. Many people with schizophrenia have difficulties with effective social skills. Social skills training aims to fix these deficits by teaching socially appropriate ways to express emotions and make requests so that people are more likely to achieve their goals, develop relationships, and live independently. Social skills are taught in a very specific way using behavioral teaching strategies such as modeling, role-playing, and positive reinforcement. Let's talk about illness self-management next. Illness self-management includes education, coping skills training, relapse prevention, and social skills training. Individuals learn about their psychiatric illness, their treatment choices, and coping skills to deal with stress and symptoms. They also learn medication adherence strategies to help prevent skipping or forgetting to take one's medication. Relapse prevention involves recognizing situations that might trigger symptoms, tracking symptoms that might be a warning sign of relapse, and developing a plan to cope with these triggers and warning signs. This treatment approach also teaches social skills in order to improve the quality of relationships with others. The next treatment I want to talk about is cognitive behavioral therapy, or CBT, for schizophrenia. CBT is a blend of two therapies, cognitive therapy and behavioral therapy. Cognitive therapy focuses on a person's thoughts and beliefs and how they influence a person's mood and actions, and aims to change a person's thinking to be more adaptive and healthy. Behavioral therapy focuses on a person's actions and aims to change unhealthy behavior patterns. Treating schizophrenia with CBT is challenging, but research has shown that CBT, when used with medication, can help a person better cope with the illness. CBT for schizophrenia is also skill-oriented and involves teaching people how to cope with life's challenges. The therapist teaches social skills, skills related to daily functioning, and problem-solving skills. People learn to identify what triggers episodes of the illness and minimize those types of stressors with the goal of preventing, or at least reducing, the chances of relapse and hospitalization. CBT also helps people learn how to view situations in a more realistic and less problematic way, as well as learn various coping techniques for dealing with symptoms such as voices or other hallucinations. This type of therapy can be done in a one-on-one setting or in a group setting. Let's move on to family treatment and psychoeducation, which is a way for families to work together toward recovery. After a period of assessment with the clinician, families then attend sessions where they will learn basic facts about mental illness, coping skills, communication skills, problem-solving skills, and ways to work together toward recovery. People who participate in family interventions have fewer psychiatric symptoms, improved work functioning, and improved treatment adherence. Family members also benefit and say they feel more satisfied with their relationship and are less burdened by their relative's illness. There are a range of family programs available. Some families benefit from just a few sessions, and other families benefit from more intensive interventions. More intensive services are especially helpful for families that are experiencing high levels of stress and tension, and for people who have ongoing symptoms that won't go away, or those who are prone to relapse. These longer-term interventions generally last 6 to 9 months. The therapist might meet with just the individual and their family, or with multiple families at the same time. The next intervention I want to talk about is assertive community treatment. Assertive community treatment, or ACT, is an approach that is most effective for individuals with the greatest needs for services, such as those with a history of many hospitalizations or those who are homeless. In ACT, the patient receives treatment from a team of usually 10 to 12 professionals, including case managers, a psychiatrist, several nurses and social workers, vocational specialists, substance abuse treatment providers, and peer specialists. The team provides coverage 24 hours, 7 days a week, and has small caseloads, usually one staff for every 10 patients. Services provided include case management, treatment planning, crisis intervention, medication management, supportive therapy, substance abuse treatment, rehabilitation services, for example, supported employment, and peer support. So the program is very comprehensive. The Veterans Administration has a version of this program as well. At the VA, this intervention is called Mental Health Intensive Case Management, more commonly known as MICM. Research shows that about 70% of adults with severe mental illness want to work, and about 60% can be successfully employed through supported employment. Supported employment is a program designed to help people with severe mental illness find and keep competitive employment. The approach is characterized by a focus on competitive work, a rapid job search without pre-vocational training, and continued support once a job is obtained. Employment specialists work with individuals to identify their career goals and skills. Case managers and mental health providers work closely with the employment specialists to provide support during the job seeking and job keeping process. Let's touch on alcohol and drug use next, because many people with schizophrenia also struggle with an alcohol or substance use disorder. This is called co-occurring disorders or dual diagnosis. Co-occurring disorders are best treated concurrently, meaning that treatment for schizophrenia should be combined with the treatment for the alcohol or drug problem. Combined or integrated treatment includes cognitive behavioral interventions and motivational enhancement, which is designed to increase motivation to stop using alcohol and drugs. Integrated treatments are effective at reducing alcohol and drug use, preventing relapse, and keeping individuals in treatment longer. These interventions can be given either one-on-one or in a group format. Lastly, I want to talk about weight gain, because weight gain is one of the most significant and frustrating side effects of many medications used to treat schizophrenia. Weight gain can lead to problems such as diabetes and hypertension, making it a serious problem for many people. But evidence-based weight loss programs are available. These programs generally last 3 months or longer and include education about nutrition and portion control. Participants learn skills to monitor their daily food intake and their activity levels. They have regular weigh-ins, and they set realistic and attainable personal goals. Participation in such programs can help prevent additional weight gain and lead to some weight loss. The Veterans Administration has a version of this program called MOVE, which is offered in a supportive group setting. That wraps up our discussion of evidence-based psychosocial treatments for schizophrenia. Join me next time to talk about antipsychotic medications, the main class of medications used to treat schizophrenia.